Hello, Dr. Kim. Nice to meet you. Can you please introduce yourself to our viewers?
Hello, I'm the representative medical director of Soonplus Plastic Surgery, specialist Kim Sun Dong.
Okay. So, Dr. Kim, today we'll be talking about lower eyelid surgery. What is it exactly? What is a lower eyelid surgery?
Lower blepharoplasty, as shown in the name, is an operation that targets the lower part of the eyelid. Lower blepharoplasty as a procedure is both a solution for the fat and the sagging skin of the lower eyelid.
So, usually, to whom you recommend the lower eyelid surgery?
With lower blepharoplasty, if we take a look at the photo over here, I would recommend it for patients with fats underneath the eyes, similar to this one, or patients with saggy skin, which causes wrinkles.
Okay. So, how is it performed? How is lower eyelid surgery performed?
Let me explain the procedure as thoroughly as I can. First, we make an incision right over here at the skin and then remove the fat that sticks out. After that, we properly remove any excess skin in order to take out any wrinkles in the area. Then, we pull the orbicularis oculi muscle and hang it here to make it seem natural. And instead of removing it all, we leave a bit of agiosal or cute eye fat.
So, is it possible to perform upper lid surgery and lower lid surgery at the same time?
Well, you can have it done together if you want. A lot of people have taken both together at the same time.
So, after the lower eyelid surgery, what should the patient do at home?
There's an incredibly vital part in the recovery period for lower blepharoplasty. Unlike blepharoplasty, in this procedure, it's not good if blood fills up over here after surgery. If blood fills up in that area, it can cause contracture, so it is of utmost importance to prevent that blood from filling up. After the procedure, we apply gauze and taping to put pressure right here. The dressing is mostly removed the day after to prevent the blood from filling up at the area. So, if it is confirmed that the blood did not fill up the day after, the next steps are similar to usual recovery treatment and process, putting ointment and heat pressure. This is vital during the recovery period.
So that was after the surgery. Before the surgery, what kind of precautions the patient should take?
As said before, it's important that the patient's blood doesn't fill up. As such, to prevent it, one should not be prone to bleeding. Most people who have lower blepharoplasty are at the age similar to the person in this photo. Older patients tend to be already taking medications, one of them usually being aspirin, which thins out the blood. There's a higher chance of blood ingress after the surgery, and if you take certain foods and supplements, some of these consumables make you bleed easily. This makes it essential to stop taking these kinds of drugs before the surgery. At least a week before is recommended. This includes aspirin and many other blood-thinning supplements. And once again, at least a week before the surgery. That doesn't mean you should stop on your own. For dietary supplements, sure, but for aspirin, you should consult your doctor on whether or not it is alright to stop taking it. Once again, my recommendation is to stop taking it a week before.
Perfect. So, last question, what are some side effects to this lower eyelid surgery?
One of the biggest possible side effects for lower blepharoplasty is that the eyes get turned inside out. So, if the incisions were overly done, the eyes get flipped and they turn redder, and that's the biggest side effect. To prevent this, cutting the right amount of skin is important. And I mentioned something about hanging the muscles. With proper clinical technique of doing this specific side effect could be prevented. Another side effect people worry about is scarring. For lower blepharoplasty, many people worry that there could be a scar. As you can see in the picture, scars aren't something you should worry about in this operation. 2 months have passed after this patient had her operation. Usually, we do the operation after we trim the eyelashes. When 2 more months pass, the eyelashes will grow again, and the scars won't be seen as they're covered by the eyelashes. So if 6 months to a year pass, there's no need to worry about the scars.
Thank you, Dr. Kim. That was everything for today.
Today, I talked about lower blepharoplasty. For those who worry about having wrinkles under the eyes, I hope this video helped you learn about our solutions. And that's it for today. Thank you.